Hi everyone, I'm Kasey Adinolfi. I am Director and Partner and Treating Physical Therapist here at PTSMC in Wethersfield. I'm going to talk today about one of the most common things I see in the clinic, and that is knee pain. So in talking about knee pain today, I'm going to discuss a few things. The first being, what are the causes of knee pain? The second, how do we treat different kinds of knee pain? And then the last, how can you prevent knee pain? Now, there's many different causes of knee pain. Some of the causes may include a ligament sprain, a muscle strain. These may occur in sports, or simply with a misstep or due to overuse. Another very common cause of knee pain is arthritis, in which there are degenerative changes in the joint. These changes may include cartilage breakdown, narrowed joint spaces, or bone spurs. These can be concerning phrases to hear, but these joint changes are actually quite common over time, and they do not always equate to pain. When they do, it usually means there is a mobility or motor deficit at the joint, or the surrounding joints, that can be addressed with physical therapy. So now that we understand the causes of knee pain, let's take a look at what some of the treatments are in physical therapy to address it. So a very common place of degenerative changes in the knee is at the patellofemoral joint, which is where your kneecap sits on top of your knee joint. There's cartilage that lines that joint, which can become degenerative over time. Very common change, especially in jumping and running athletes. I'm showing here a patella mobilization. The patella needs to glide up and down, as well as side to side. And I can do different grades or intensities of mobilization based on what my goal is for the patient. If I'm trying to reduce pain and inflammation, I'm going to do very gentle, low-grade mobilization. And if I'm trying to increase her overall knee mobility, I might do a higher grade mobilization where I'm really taking that joint to its end range. So while I would love to see you in the clinic for some physical therapy, there are ways that you can prevent knee pain or prevent a muscle strain or a ligament sprain. These very often occur due to a weakness elsewhere in your body, very commonly the hip and the core. So strengthening your core and your hip musculature can be huge in preventing knee pain in many cases. Of course, there's also serious injuries that can occur when you strain a ligament or a muscle due to a sudden, fast force at the knee. But again, having a strong core and hip will help to make those injuries less severe. In her assessment, I found that Leah here has some weakness in her hip abductors, which can be contributing to some increased stress at her knees. So I'm going to have her do what's called a lateral band walk with some appropriate resistance to strengthen those hip abductors. Go ahead, Leah. She's trying to maintain tension in the band the whole time as she steps, and she's keeping her knees in good alignment right over her second toe. So another progression to really strengthen those hip muscles for Leah is a single leg bird dip, to really work her posterior chain, and we're also challenging her dynamic knee stability here. This is an exercise we may do towards the end of Leah's rehab after a sprain or a strain to really make sure that dynamic knee stability is there for her return to her sport or whatever her leisure activity may be. So I mentioned earlier how important strengthening the core is, both for the treatment of knee pain and in the prevention of knee pain. A great exercise, which is very safe to do, is a plank. So Leah's going to show us a few different variations of a plank, this being the highest level, a high plank. This is a little too challenging on the shoulders or the core. She's going to bring it down to her forearms. And we can also come down onto the knees, focusing on maintaining a nice neutral spine. She's drawing that belly button in to feel for core musculature. And we can also do some side planks here. Same thing, we can do the side planks. We can come all the way up. We can come down to the forearm. And we could also do these on the knees as a progression. Again, working our way all the way up to that full side plank. And this is getting those obliques on each side of our abdominals. If you are experiencing knee pain, please give us a call here at PTSMC in Wethersfield. In the state of Connecticut, you can seek PT direct access, which means you do not need a referral from your doctor in most cases. You can also set up an appointment directly with us through our website, www.ptsmc.com/Wethersfield.